Some sobering statistics to bring you here in the second segment here on Roundtable today, talking about infant mortality here in the state of Ohio. And when you look across the board when it comes to the 50 states and where they sit on a baby's fighting chance to survive, the state of Ohio is 47th on a list as far as babies being able to survive. In fact, out of 1,000 births, these stats going back to 2010, 7 out of 1,000 don't survive. And we've got Dr. Kent Bishop here with us today, also Dawn Lyman. She is the Northwest Ohio Division Director of the March of Dimes, joining us this afternoon. Thank you so much for taking some time here on the Roundtable. A couple of weeks ago, we saw the March for Babies, once again, an annual event that brings out just droves of people supporting that effort. But doctor, as you look at these, I said sobering statistics, and what does it say to you seeing Ohio so low on that list as far as a baby having a fighting chance to survive birth? Or the first year, really, is what we're talking about.
That's how we define it. We define it from birth to the first year of life.
Yeah.
And the numbers are staggering. Over 1,000 babies per year die before their first birthday. And of those, there's, for babies born from 1 month until their first year of life, up to 42% of those deaths are sleep-related accidents. 3 babies die per week in Ohio, just sleep-related accidents alone. So it's really, I see that as kind of a call to action, and that's has begun on many fronts, and it began long ago.
Listening, you were saying as far as the sleeping is one issue, but we're looking at education being another and trying to get word out. And I know that's where the March of Dimes comes in each and every year, trying to get more and more information out to parents.
Right. And a big focus right now is safe sleep, the ABCs. You'll see PSAs on TV, and March of Dimes is not only researching and funding those types of things, just about the baby should be alone on their back in their crib without other things, and that's going to make a big difference. Most
infant deaths occur when babies, I want to show some of these specifics, born too small and too early, born with a serious birth defect, victims of SIDS, we have talked about that in the news year after year, affected by complications of pregnancy, victims of injury. Tragically, over the last couple of years, we here as a news organization, that last category, we cover that time and time again. But doctor, as you look at trying to improve Ohio's ranking and where it sits, what do you see needing to happen?
Well, the Ohio Hospital Association and Ohio and the state in general have really looked at a bunch of areas for tactical focus. One is to decrease deliveries prior to 39 weeks elective. Also to eliminate those deliveries before 39 weeks. Progesterone supplementation for mothers at risk for preterm birth, because as you know, that's the most common cause. When the baby's born early, then they have a higher risk of not surviving to that first birthday. We talked about breastfeeding and promoting breastfeeding, and not only promoting it, but making that something that is easy for our mothers to transition to once they deliver.
And often, and sometimes a struggle.
Yeah,
as I know, I mean, father of 3 myself, and I know when the lactation consultant comes in and tries to help the mother through that process. But you're saying that's really important as far as breastfeeding is concerned.
Absolutely.
Go on, you were saying.
And we put barriers. We've had barriers in our hospitals that precluded mothers from breastfeeding, that we're just trying to eliminate all those barriers. And I see, on our labor and delivery floors, and I think throughout Ohio and the nation, everyone is trying their level best to improve that trend. And I think they've made some really good inroads, but those inroads continue.
Talk about safe spacing between births and why that is so key.
And when we say that, we're saying that's from, we'd like the mom to deliver 18 months between deliveries.
Okay.
The data kind of proves that if you deliver within that 18-month window again, that your risk for preterm birth goes up. And if you preterm birth, then you have higher risk for infant mortality. So we talk about contraception. Again, that becomes a teaching component, but really just having people understand that if you deliver within less than 18 months, that you are putting yourself at risk.
So many people affected by this, and when you put together the March for Babies, and you see so many families, so many stories, what are some of the ones that stand out to you, and what are you seeing year in year? You're seeing more and more new faces?
Absolutely. Every year, new families. To me, the losses are very emotional, very powerful, but a lot of young babies, a lot of young kids that were successful, who made it out of the NICU healthy. That's an inspiration for everyone there. We were really lucky this year to have great weather in Toledo, 4,000 walkers.
Yeah.
It was a really great event.
You brought up the NICU, and these units are getting bigger and more important at some of our area facilities, yes?
They are. I mean, they provide such outstanding care. I think what's so interesting is that the focus has always been on when the baby's there, what can we do to improve their outcome? And now we're seeing so many different ways through social determinants and other avenues that how important it is to try to prevent that from ever occurring.
Yeah.
And that seems like that's where we're seeing such great efforts. And they're just getting started. I mean, they can improve. There's people on legs on the ground, people on the ground that have been working at this for years and years and years. And at least at ProMedica, and I think throughout the state and throughout the local area, we're really trying to say, what can we do?
Yeah.
Where can we intensely focus our resources and efforts to prevent this?
Crux of our conversation here this afternoon, talking with Dr. Kent Bishop, also Dawn Lyman from Northwest Ohio, Division Director of March of Dimes. Statistics just kind of make you stop and think. 1 in 9 babies born prematurely in the United States, but 1 in 8 in our area. And some of those factors, non-medical contributors to the death of babies, talking infant mortality, those include poverty, lack of education, under-resourced neighborhoods, poor nutrition, and also race. Those all play into this?
Absolutely, absolutely. And there's as far as the disparity among race, the Ohio Equities Institute is working tirelessly regarding that issue. And on every single tactical focus area, they're trying to laser focus on why there is disparity among race. We're 49th in the perinatal mortality for black infants. We're 36th across the country for white infants, and that's a common theme throughout our country, and it's just frankly unacceptable.
Dawn, when you look at lack of education, under-resourced neighborhoods, poor nutrition, those are all things that are fixable. I mean, you may have people out there watching today, though, are like, well, what can I do about that? You know, I live where I live. If it's an under-resourced neighborhood, what am I supposed to do about it?
Right. You know, that's why we have our walks. We are fundraising to provide education and support for at-risk parents and parents with babies in the NICU, parents who lose babies. We're also doing the research on why these things happen, and like Dr. Bishop said, you know, trying to understand why it happens and figure out some way to prevent it. And we're advocating at a state and federal level for better pre-screening for infants. And recently, now October became National SIDS Awareness Month to bring some more attention to that.
We've seen a couple of these walks happen the last couple of weeks. We got another one coming up on the 10th, correct?
We do, in Findlay.
In Findlay, and then you said there are a couple of more events happening after that.
Yep, we have our Signature Chefs event on November 3rd at the Pinnacle, which is a really fun, kind of a nice night out.
Yeah.
And then we also have Bikers for Babies, which takes place in September, and that's a ride for motorcycle riders.
Want to point you in the direction of marchofdimes.com/Ohio. You can get more information as far as the local efforts are concerned. Thank you both for spending some time here on the Roundtable with us. We'll be back, wrap things up right after this.